Hello, Catherine.
Hi, how are you, Dr. Volgman? How are you?
I'm good, thank you.
That's great. You ready?
Yes.
All right, let's go. Hi, this is Catherine Raker of Let's Just Talk. Do you know that approximately 1.5 million American women are currently living with atrial fibrillation, or AFib? AFib is a heart rhythm disorder that can lead to lethal or life-impairing stroke. Women with AFib are much more likely than men with the condition to have a stroke. Despite AFib's seriousness, many women, including those who have the condition, report not knowing much about it nor what the symptoms to look out for. According to a recent survey conducted by WomenHeart, many patients report not receiving enough information and resources from their doctors, and thus can feel very unprepared and unsupported. Today we have with us Dr. Annabelle Volgman, who is renowned with the medical community for being the forefront of women's heart health. Very happy to have you on our show today, Doctor.
Thank you so much for having me.
Oh, thank you. You know, what is AFib and how many people are really affected by it, Doctor?
Actually, the recent statistics are that 8 million people live in the United States with atrial fibrillation, about 33 million worldwide. And so there are a lot of people out there with atrial fibrillation. And because atrial fibrillation increases the risk of women having AFib to have strokes and heart failure, WomenHeart, which is a national organization for women with heart disease, is launching the first virtual support network for women living with atrial fibrillation and their caregivers. So if they have atrial fibrillation or they know somebody who has atrial fibrillation, please have them go to the website and register for the virtual support network by going to womenheart.org. And it will provide them with the education and emotional support that people who have atrial fibrillation need. And as you said, there are a lot of people out there who don't get enough information from their healthcare providers, from their doctors, because the visits are so short and they have so many questions and they forget to ask their doctors these questions. So if they go to this website, there's actually doctors who will answer their questions. There's a lot of questions that women have who have heart disease, and this support network and this website will give them those answers.
Well, AFib is really a rhythm disorder, isn't it?
That's right. It's an irregular rhythm, and sometimes people with atrial fibrillation will have symptoms of palpitations or flip-flopping in their chest or a fluttering in their chest, but sometimes they'll just feel short of breath or feel fatigued, and it's actually atrial fibrillation, and some people don't even have symptoms, so they can just find out about it if they go to their doctor. So if they have any fatigue or shortness of breath, they may want to get checked out for this.
Could it be a racing heart, Doctor?
Absolutely. So people with atrial fibrillation can sometimes have fast heart rates, and that's exactly what causes the heart failure. So it's important to get help when they feel like their heart is racing, because they need to control their heart rate.
And if I remember correctly, my daughter went through it, and we rushed her to the hospital twice. And then I think, was there a stent? Could they have put a stent in or something in to cause it to stop doing that at one point?
So your daughter, I gather she's very young, because you sound very young.
She's in her 40s. I'm actually 70. So.
Oh my gosh, you sound so young.
Right. Thank you.
So that's, even for a 40-year-old, atrial fibrillation usually is in older people, but people who drink alcohol, if they have high blood pressure, if they're obese, or have sleep apnea, they can have atrial fibrillation. So, you know, unfortunately, it doesn't discriminate. So it can happen to a lot of people.
Actually, she hit it a lot younger.
Wow.
It started happening to her in her late 20s, early 30s.
Yeah, so I would work her up a little bit differently. I mean, I don't want to make this personal, but, you know, she should definitely go to a cardiac rhythm specialist, because she's awfully, she's awfully young to have atrial fibrillation, and then there are other causes in younger people. But for the most part, people who who have atrial fibrillation are older, so they're at higher risk for strokes because they have other comorbidities or other risk factors such as high blood pressure and heart disease that can cause the increased risk of stroke and dying from atrial fibrillation.
So what do they typically do, doctor? Do they put a stent in?
No.
Or what do they do?
So atrial fibrillation is a totally different kind of disease than putting stents in. Atrial fibrillation causes the heart not to actually contract, and so it doesn't allow the blood to flow freely. So it can collect in the crevices of the heart, and these blood clots can break off and cause strokes. By breaking off, it goes directly to the brain, and then it can cause severe debilitating strokes. And so we can actually prevent 80% of these strokes if they put them on the blood thinners that are necessary for most people to be on when they have atrial fibrillation.
And that's really important.
Absolutely. If we can prevent all the strokes that we can prevent, we would have a much healthier and happier population, because the strokes from atrial fibrillation are debilitating, if not fatal.
Wow. And where can people go to get more information, again, with that wonderful website that you were talking about, Doctor?
Yeah, please have them go to WomenHeart.org for a lot of information.
All right, and thank you so much for joining us today on Catherine Raker's Let's Just Talk.
Thank you so much, Catherine.
You're welcome. Thank you.